Welcome everyone. Thanks for joining us today. So Jodie's recently had artificial disc replacement. Yay! And he wanted to share his experience with you and everything about it because we think it'll be really interesting for you. So I thought we ought to kick off with a brief medical history, Jodie.
Okay, there you go. So hi everybody. Really great to talk to you from Portugal. Fortunately, I had the surgery about 2 weeks ago, a little bit more than 2 weeks ago, and the weather's been fantastic. I was supposed to be in the hospital for like 5 days, and they let me out after 2. And the weather is like 20 degrees every day. There's sunshine on the terrace. Sorry, I'm probably making you guys jealous, but
yeah, stop that.
I won't do that. No, it's really cold and rainy here. I wish I was back in the UK, going on the tube, the Charing Cross. No. It's that 3 weeks ago was the culmination of a long period of time where I've had chronic back pain, probably for about 3 years, on and off. And I thought like about 6 or 7 years ago, I thought my biggest asset was my ability to work, right? Actually, my ability to work was more valuable than anything. So I started at the gym, going every day to the gym. I lost 15 kilos. I got into really great shape, but probably did too much. And as a consequence of 45 years of osteopathy and maybe seeing 200,000 consultations, standing all the time and working long hours, my back just went kaput. I mean, you've seen bad back, guys. And this was like, it was like no disc, osteophytes everywhere. Man, when I looked at it, I thought, oh shit, what am I going to do? Sorry. You can bleep that out if you're doing it on the BBC. But anyway, it's for the last 3 years, I've been kind of managing it with exercise and osteopathy and massage and reflexology. And in the last year or so, it really got out of hand. And I was in pain like all the time, except when I was lying down. And of course, I had various different exams. I thought maybe it was part of my old rheumatic arthritis, which I had some years ago. That's a whole nother story. I won't even get into that, but it wasn't. I saw the rheumatologist. It wasn't that. It was strictly mechanical. And so we tried a little procedure about 18 months ago where they go into either side of the foramen. That's an interesting procedure as well. It works for some people. Can you see that?
Yeah.
Because I can't see myself on the screen, so I'm not sure. So they go on either side of the foramen and they clean it out.
Hold up slightly more then.
Yeah?
Oh, yeah.
So they go into the foramen and they clean out on both sides. So it's a little procedure, but it is in the theater and they do it under anesthetic, really nice anesthetic. I was there in the room before they take you in. They put this stuff in my arm and I said to the anesthesiologist, I said, oh, is that the sedative? She said, yes. And then I didn't know it was the anesthetic. So I started to dream about being on the beach and everything like that. And all of a sudden I was back there and the nurses were talking about lunch. And I said, excuse me, nurse, can I have my surgery before lunch? And she said, you've had it already. So anyway, it was a little bit painful, that procedure. And the nice anesthesiologist came over and gave me some morphine. And I floated away on that. But unfortunately, when I got back home, and after a few weeks, there was no difference to my level of pain. What was my pain? It was basically pain in the low back, especially on the right side, and pins and needles down my leg.
Oh, you came to that, yeah.
Yeah. So right around, let's see, where did that go again?
All
If you
right.
could show me that sign,
1 second, Jody, because what I'd like to say is if you want to ask Jody any questions as we go, you're more than welcome.
yeah,
He's not just here to talk at us, but
no, no, no.
no, in the
I really want to,
in the reactions tab at the bottom, you can raise your hand. So just raise hand and then I can see and I can bring you in and we can do it,
right.
Tidily.
No, I just want to get across the main things, which is basically I did a lot of stuff. I didn't, you know, I didn't just say, okay, I'm going to have an artificial disc replacement. I tried everything, you know, from psychotherapy to manipulation to swimming all the time and strengthening my back and resting my back. And I was just, as soon as I got up in the morning, I was in pain. And I got to the point, you know, I was seeing 4 or 5 years ago, I was seeing 15 patients a day. And now, if I see 3 or 4 in the morning, I'm all tuckered out. And I take a break in between each patient. And then I come home and rest for an hour. And then I see 1 or 2 patients. And then I go and I basically lie down for the rest of the night. So lying down is okay. The doctor called it, the surgeon, Professor George Minero. He's been doing this for 20 years, apparently. And I can remember actually more than 20 years ago, he asked me to get a group of osteopaths together, and he was going to give a talk and a presentation at the hospital about artificial disc replacement. I never knew I would be one of the candidates at some point in time. But apparently from that conference that I organized for him, he got lots of work. So he's really keen to work with osteopaths. And I came to believe that, you know, orthopedic surgeons are more like osteopaths than anybody else in the medical field, because they're really looking at structure and function as well. And the other thing is it has to work. And the orthopedic surgeon wants his surgery to work. And the good ones aren't going to operate on you unless they know that they can get some kind of benefit. Because if something goes wrong, they have that patient around their neck for the rest of their life. You know,
what was the surgeon's name again?
George Minero, Professor George Minero. Fortunately, I met him like in 1986 or 87 when I first came to Portugal. One of the first medical centers I worked in, he was the orthopedic guy coming in on once a week. And he basically moved on in his career and became the director of orthopedics at the biggest private hospital in Portugal, which is in Lisbon, just outside of Lisbon, where Expo 98 used to be. I think it was Expo 98. And he learned this technique and he's been doing it for 20 years. He told me he does about 3 of them a month. And the extraordinary thing is they go in through the abdomen, so they don't have to cut any muscles from the back. And lots of people leave in 1 or 2 days. And they've got the technology down pretty well. I didn't bring any PowerPoint stuff because I thought you guys, if you're interested, just look it up. There's plenty of YouTube videos. There's plenty of animations, which are really instructive. And there's lots of stuff on the internet about it. I don't want to bore you with it here. I think it's more instructive if I just talk about my experience, which was at this point in time has been really positive. Do
you want to tell us about the day itself? What they did, how it happened? And
yeah. Well,
is it relevant to share your age as well, Jody?
73 years old, and I want to work at least for another 10 years. That's the other thing. I'm really motivated, and with I've been, you know, because of my work with Julie over the last 3 years, I'm able to basically manage my clinic from my bed, where I'm spending like 90% of my time. And that's incredible. You know, I'm making appointments, I'm talking to my associates, I'm talking to patients, I'm prescribing exercises and medicines from my bloody bed. And which is amazing. I wouldn't have been able to do that if I didn't take on a life coach and go on to Clinico. Which has been a real big change. And I think, I want to, what I want to do is kind of teach that to other people in Portugal and other places. Because a lot of osteopaths are like technophobes, they think, oh, just do a good job and they'll beat a path to your door. Well, that used to be in the old days, but not anymore, man. You got to get out there. So it's a long history of back issues. I didn't just do it. And, I tell patients when they come in that surgery is the last option. And most of the time I tell patients not to do surgery, that wait a while, wait another 2 months, wait another 3 months, stay with me. We can usually get them better. 99% of the time, they're actually better. And a lot of people who have surgery have successful surgeries, not necessarily disc replacements, but other things as well. They're pretty good these days. The surgeries aren't as invasive as they used to be, but still, you still get bad results. The success rate for artificial discs is similar to hips and knees, which is close to 90%. And most people give a rating, if you had to give a 5-star rating, it's sort of the same rating you'd give to your iPhone. If you looked at all the phones in the world, say, okay, this is like, for most people, I think 75%, it's like an excellent effect. And then for like 10 or 15, it's a really good effect. And then there's always people who have problems in any surgery. There's about 10% that don't do so well, and 1 or 2% that get really serious problems. So there are some risks as associated with any surgeries. And they do these in the neck as well. It's actually easier to do it in the neck, from what I understand. I think on the day of the surgery, we went in there, and fortunately, the other thing is, I'm doing this as a private patient. I think they probably do it in the health system here, but it would take you like years to get there. You'd really have to wait years to actually get the authorization to have a disc replacement. I think in the UK it's the same thing. They have certain centers that do disc replacement, and they can be done on the NHS, but not everybody does it. Because basically there's not a lot of people who have expertise doing it, and they're used to doing fusions. Now, the difference between a fusion and the disc replacement is fusions have a lot more secondary effects. And because when you fuse something, the one above and below do too much work, and they get worn out. So that with an artificial disc, which actually moves, if you see the animation, you'll see that it actually moves with you. You don't get the problem with the problem above and below, and you don't get wearing out of those. And apparently they're much more successful than the fusions are because of that. And they're really sturdy. There was a guy who had a motorcycle accident, and he broke his ribs in his arms, and his 2 discs were okay. So I was prepared. I've had a number of surgeries in my life. So for me, it's like going to Disneyland at this point in time. It's just learning something. So they put the stuff in my arm, I went off, and then I had the surgery. I think the surgery lasted about 2.5 hours. They put one in at L3, L4, and another at L4, L5. After the surgery, I woke up in the intensive care, which they do just as a matter of fact for about 12 hours to make sure everything is okay, make sure there's no clots, which is a big issue. And I woke up about 12 o'clock at night, and for 1 or 2 hours, I was kind of in a lot of pain. It was like it's kind of searing pain in my back. And then the nice anesthesiologist came over again and put some morphine into my arm, and I floated off onto a cloud. And then about 6 or 7 o'clock in the morning, maybe it was a little bit later, actually the surgeon came in, and he had his little hat on, those little hats that they wear. He said, "Well, Jody, I think we did pretty good. It looked like everything went really well. Now let's see you get up and walk a little bit. So, this is like 8 hours after the surgery, man, and
Oh,
I get up and I walk a couple of steps, a bit amazed that I do it myself, but I can do it. So that was really great. He said, okay, we'll get you upstairs by lunchtime. So a lady comes in from the kitchen and they say, okay, this is what we have in the menu. For lunch, would you like to have fish or turkey? And for dessert, would you like to have this or this? And then for dinner, what do you want to have for dinner? Are you going to have meat or fish? Would you like to have ice cream with that or fruit? And they went through every meal,
you were having 5-star treatment, you were, Jodie.
every bloody meal. And then they bring me up to the room before lunch. And I was hungry because I hadn't eaten much. I think in intensive care, they gave me these little, what they call biscuits. They called Tia Marias and a cup of tea. But when I got upstairs, I was happy to have my lunch, which was turkey with mushrooms and carrot soup.
Jodie, someone's asking, Bob was asking, have you got any before and after scans?
Oh, yeah. I haven't examined them. The doctor has them. And when I see him next time, I'm going to ask him about that.
Yeah, 'cause
But
that'd be
what I saw is this, because it was the before scan, the MRI. I mean, when you see you guys have seen bad, people with messed up spines. Mine was like the most messed up I've ever seen in my whole life, and I've seen lots of them. There was least spondylolisthesis is going that way. The bone was that way. Everything was twisted up. It was a mess, man. And originally, when I went to see the doctor for the first procedure, this small procedure, he was like, well, what are we going to do with your back? It's such a mess. So we tried the small thing first. It didn't work. And when I went back to him 4 weeks ago, it was only 4 weeks ago now, I said, George, I said, I'm just in pain all the time. He said, okay, right. We're going to do he was right for it. He went for it right away, which I was glad about. A bit shocked. And my family from Australia was here. So we had to wait for them to go. The house was full of 6-year-old kids breaking everything. Forgot that 6-year-old kids break everything, but they do, as you guys know. The banister, the curtains, everything. 3 o'clock in the morning, I want cookies. So anyway, we come up and we have lunch, and then they take me down to the x-rays. And I said, the last time I was there, which was 2008, when I had my knee replaced, they brought the x-ray machine to you, right? So I thought they were going to do that. They said, oh, no, you have to go down. So the guy comes in and rolls, how you roll you in the bed, like you see in the movies, So he takes me down the hall and into the elevator, and we go to the x-ray place. And I see the spine, and it's straight. It's like straight for the, I saw the lateral, and it's like it's got a curve, it's got a nice curve there. And there's spaces between each vertebra. And I can see the artificial discs. And I can also see some screws that he put in, because apparently because of the issue, I don't have a chronic scoliosis, but over the years, my back sort of went over to the right. So he kind of straightened that up as well. That's the thing that hurts more than the implant of the artificial discs. Because for the scoliosis thing, he had to kind of get into the back a little bit. So now when you look at my back, you'll see good spaces. And I stayed in the hospital for 2 days. I was supposed to be 5 days, but I think I was feeling okay. And I think he felt that, I knew what I was doing in terms of medication and things like that. So came home and basically have been taking it really easy. The first day, of course, I came home, I did too much, because you come home and think, oh, great, I'm going to be okay. and that night I was in pain again. So really had to take it easy. And I have another 2 or 3 weeks of taking it easy. I have to really to get this better. But every day seems to be a little bit better. Every day I have more mobility. Hi, Laura. How you doing? How you doing?
Sorry.
Okay. Can you still see me?
Yep, you're there.
Okay. So
While we stop, just if anyone's got any questions for Jodie, please just press the in the reactions tab at the bottom, put your hand
It's-
up. And
it's
then
really
we can
it's
bring you
really
in.
a question of time now. So I'm really up for asking any questions, guys, about cost as well. I mean, I think that's important as well. You know, I looked at the different costs. In the UK, it's about 40,000 pounds, I think, or something like that. In Portugal, I mean, at the moment, for the time I spent at the hospital, they've charged me about 25,000 euros. My private insurance is paying for a large proportion of that. Perhaps that's one of the reasons why they don't do it all the time, because it's quite expensive. But if it's as good as I think it is, you know, and I was scouring the internet for bad reviews, and I can't find them.
That'll be why. Jodie, Cheryl's asking, can you explain what the artificial disc is made of?
Yeah, well, there's different materials, and over the years they've they've changed. Some of them are ceramic, and some of them are metal. But in the middle, there's like a plastic bowl. So they slide it in. They slide the bottom bit in. First of all, they go in through the abdomen, push away the intestines, make sure they don't hit the vena cava or the aorta, because those things are around there. Apparently, that's one of the things they have to worry about, and that's why lumbar area is more difficult than neck. You don't have so many structures there, from what I'm told. So anyway, and they have a whole team there. You know, they've got the surgeon, they've got the assistant, they've got somebody looking after the blood vessels. They've got lots of different people looking after different things. They have the anesthesiologist. So they go in and they first thing they do is they take out the old disc. So that with Kuipers, you know, these it looks like big tweezers. They go in and they just take out the old disc, and they make sure that the ligament, the yellow ligament, the ligament amarello, longitudinal ligament, they make sure that that's away from the body of the vertebra, because they want to be able to slip that disc in there. And they do it with a kind of contraption. It's like they kind of slide it in there, and then they knock it into place like orthopedic people like to do. They like to use knives. And
Jodie, how do they keep it there? Dawn wants to know.
well, it's coated with a special material which attracts bone growth, right? So the other thing they use a bit of cement and a little bit of bone. So they took a little bone from my hip and they used a little bit of cement, but and that sort of keeps it in place. But ultimately your body takes over and just kind of everything meshes together. So it's not easy to take one out. You know, if you have to go in and do it again, the whole thing becomes part of the bone.
Okay,
So
Jodie.
they use cement and they use part of your own bone.
Cool. Gabby wants to know, how long is the surgery good for? I.e., when may someone need a second surgery due to the artificial disc failing? For instance, a knee replacement may need to be redone within 10 to 15 years.
Exactly. I mean, my knee was done in 2008, right? I'm not good at math, but that's a long time. It's 2023 now. And I can tell you, my knee is better now than it was 2 or 3 years ago.
Wow.
Or 5 years ago. And 2 years ago, I think I fell in the kitchen. I fell over the dishwashing. The dishwasher was open, and I had one of my wife's favorite plates in my hand. So rather than let it go, I fell on my bloody hip.
Oh,
thought I'd broken it or hurt my artificial knee.
yeah.
And the next day it was really painful, mostly in my hip. So I went to see the surgeon who originally did it, Ricardo Varatajo. He's the specialist in it in knees in Portugal. And he took an X-ray right there, which is great. You know, you go to the office. He said, "Oh, you just go down the hall, get an X-ray, and then come back here." And we compare it to the one you did in 2008. And he looks at it, he says, "Oh, it's fine, Jody. Take a couple of anti-inflammatories and you'll be fine." And it's still fine. So, you know, these things can, and in terms of the artificial discs, it's about the same thing. You know, I've seen like Zoom conferences with people who have had surgeries, and there were people who had it for 2 years, there were people who had it for 15 years. One of those guys was the guy who was the motorcycle. He fell off a motorcycle and broke his ribs in his arms, and his discs were okay. They're really resistant. You know, then in the early days, I think the materials wasn't so good and wasn't so would wear out. But the things they use these days, they don't wear out, and they have the movement. They keep the movement, which is essential. Because if you don't have that sort of annulus thing, you know, to make it move around, then everything above and below is going to start to get strained as well. And of course, when they go in, so they take out the disc, the little Kuipers, and then they put something in there to make the two vertebrae go distract apart. And then while they're distracted apart, they make a little slit on the vertebra above and the little vertebra below. And then they slip the artificial disc into that slit on the bottom. And then they do it on the top as well. And then they put the plastic thing in the middle, and then there it is. Now, there are various kinds of artificial discs. And if you can go, and there's like lots of companies are into making them. Some of them come as a brick, like they're self-enclosed, so they go in just one. Some of them go in as I showed you, and you can get them in all sizes. And the surgeon has to decide what size disc and what the angle is, depending on if it's an L5 or an L4 or an L3. The discs are actually made, the artificial discs are made in different angles to actually fit your spine. They're almost custom made for you, you could say.
Cool. Phil wanted to know, what are you now able to do on a day-to-day basis? Are you back at the gym? What are the things which you're most looking forward to now?
Well, I'm looking forward to getting back to the gym. I'm nowhere near there now. I mean, I'm sitting here for like 20 minutes. This is a big thing for me. You know, I'm basically spending most of the time in bed. I probably spend like during the day, I spend 70 to 80% of my time in bed. And in between that, I walk around. And in the beginning of the day, I've got more energy, and if I walk too much, I start to get tired and I start to get the pins and needles in my leg. But every day is a little bit better. And the recovery period is like 4 to 6 weeks. So I'm in my second week at the moment, and I'm happy with the progress so far. I'm also happy to have time. You know, it's like 45 years. I've never taken this kind of time. It's like, it's the first time I get a free pass to do nothing if I don't want to.
Free time, and I'm not even on your back.
I don't have to think about dinner. I don't have to help with dinner. I don't have to take the garbage out. Don't have to worry about the dog. It's like,
nice.
That is really, really something. And I'm enjoying it, but I'm not abusing it. If I was abusing it, my wife would tell me for sure.
Jody, Norma Jean says, what are the risks with regards to the actual artificial disc loosening or moving?
I don't really know. I think probably this, the same sort of risks that you have with a hip or a knee. And they're pretty stable. Bone, once the bone starts to to mesh around it, it becomes part of the system. So it doesn't really move. It might wear out if or crack if you fall on it or something like that. I think the biggest risk is basically infection, like with any surgery. You know, and actually that's one of the reasons these days they want to get you home as soon as possible. It's not just because they want the bed, which
Get
is
you out.
expensive, but basically people have get less infections at home. You know, in hospitals you get super infections. So, and you never know where it's going to come from.
Katrina's interested to hear about the rehab program from point of hospital discharge and how has it been going?
Well, the rehab program, for the first 2 weeks, the rehab program is just walk. That's it. I said, and I've asked him a number of times. I said, that's it. You just walk. He said, yep, just walk. You know, every day try to walk a little bit, and every day try to walk a little bit more. And once we know everything is okay, probably after 4 to 6 weeks, we'll start to do some other things. I mean, in the meantime, I mean, I'm doing some upper body exercise. You know, I'm working on my arms and stuff like that, but I don't want to do anything that impacts my back at the moment. I don't want to do any abs. I want to listen to his advice. He's been doing this for 20 years. When I went back to see him last week, after 8 days, I went back to have the staples taken out. That's what they use these days, staples. You look like Frankenstein. And the nice nurse there, she took out most of the staples. And I actually asked the doctor, I said, or the surgeon, I said, you know, can I have the staples taken out at my clinic? Because it's just around the corner, you know, and it's easier. And he basically said, no, he said, I'd like my orthopedic nurses to do it because they know if there's anything wrong. You know, they've seen it. They've been working with me for 20 years. So that's a good reason to, you know, travel across town at 8 o'clock in the morning. And that's what they did. They took out most of the staples. And then about 5 days later, he wasn't there at that time. I think he was at a conference. And 5 days later, I went back to see him personally again, and he had a look at it, and it was a bit swollen. So I've got a bandage on my back from like L5 to about L12, D12, and it was pretty swollen up. And I thought it was just like normal, you know, swelling. But in fact, he put a needle in there, and he took out about 100 milliliters of blood. He said, look at that. I said, that's normal. So afterwards, it felt a little bit lighter, you know, I could move a little bit better. And I'm in the process. I would, you know, anybody who's got a really tough back that you've tried everything with, and there's no spaces left between the vertebra, I think you should look in your area about artificial discs and if they're available on the NHS. I think they're available in some areas, and what the private situation is.
Yeah. Norma Jean says, from your own research, Jody, do you know if this surgery actually prevents further disc degeneration at levels below the site of surgery?
Oh, absolutely. There's absolute proof that, you know, if comparing this to a fusion, all the doctors will say there's no question about it, that a fusion basically means that the ones above and below are going to blow at some point in time. And with the artificial disc, you still retain the movement, and you don't have the problem above and below.
Okay. Dawn says, we'd love to get an update on your progress in a month's time, please.
Great, me too.
One
One of my things, I really want to go back to the gym. You know, I paused my membership. I was able to pause my membership because of health reasons, which means I don't have to pay the joining fee again. And we have a special rate. You know, normally it's like one price, but I got in at a discount price to a really good gym, which is open from 7 o'clock to 9 o'clock at night and has everything that you need, including the sauna and the Turkish bath and the hydro pool and all the machines. So I'm looking forward to getting back to do that. I'm looking forward to actually getting back to the clinic and getting more associates in and working less and managing them more. And enjoying life more, because I really, the last 2 weeks, 2+ weeks, I've really enjoyed doing nothing, but I haven't been doing nothing. It's like the freedom of not having to earn money like that. It's just opened up my mind incredibly. And my mind is just popping with ideas, and my associates are really responding. One of them is just soaking it up. And, I'm teaching her about digital filing and online booking and working with patients. And we have different ways of working as well. And I don't ever say to associate, you have to work this way. If you're a classical osteopath and you want to work with fascia or cranial, you work your way. I don't want anybody to work my way. You've got to work your way. We can talk about it. And sometimes associates don't click with your patients, and sometimes they do. But I'm there to give them support, and I want them to succeed. And I want to, it's such a great thing to be able to have having an online presence, digital files, being able to reach out into the community, and it's such a powerful tool, the technology.
Yeah.
And it also makes me feel safe, in the sense that even if I was to be completely handicapped, I can make money. And although I'm retired, I've got a pension from the US. I worked 4 years in the US as a taxi driver. In the evenings, I went to university so I could get into the BSO. And those 4 years, I didn't think I was going to get a pension from them. But when I applied for my Portuguese pension, I got a call from the American Embassy, and they said, Dr. Jacob, they call you doctor if you're an osteopath there. Dr. Jacob, don't you want to apply for your American? I said, I only worked 4 years as a taxi driver. They said, well, we have in front of us 20 quarters. If we put that together with your Portuguese, you'll get something. So for the rest of my life, I'll get $200 from the United States government, and $100 for every American child under 18 or still in education.
Good for you.
Then there's my Portuguese pension, which is mais ou menos, as they say. And I'm waiting for my UK pension to kick in.
We're just going to call you Pension Man from now on. You're rolling.
That's it, man. I mean, we spend our whole lives paying that stuff.
Yeah.
So it's not a lot. And that's why, I like to work. I like to have the extra money in my pocket to do the extra things that are fun to do.
Jodie, Norma Jean says, will patients still be able to have MRI post-surgery in years to follow?
Yes. They use either ceramic or titanium, or they use a metal which is not affected by it's not magnetic.
Oh, that was Philip's other question. Any metal parts? If yes, have you prepared your speech for airport security?
Yeah, no, well, I've been going through that for years because I've got the knee, right? So every time I go through airport security, my knee beeps because I have a prosthesis on my left knee. And so I'm prepared for that. Apparently in the United States, when you beep, you actually have to carry like an MRI with you, to show them what you've got.
What's in there? And Peter says, what level of activity do you expect or hope to achieve when you're fully recovered?
Well, I expect to be able to go to the gym on a regular basis and, to do a little bit of cardio, fast walking, and then hit the machines at all the machines, from the leg machines and the upper machines and upper body machine. I hope to be doing swimming. I really enjoyed my swimming. I got into the habit. I started at the gym with swimming because I was really unfit at the time. And I started with a couple of laps, and I moved it up to like 20 laps of of crawl, 10 laps of crawl and 10 laps of backstroke. And I was having problems with my neck because of the crawl. So I got a snorkel, a Speedo snorkel, and I would do my crawl with my head in the water, which was absolutely amazing because it's a great time to meditate. All you can hear is your breath. So it's like, and it's a great time to kind of just stay with your breathing and anchor yourself in your breathing. And then I do the backstrokes. And I got to the point where I was using hand flippers and foot flippers, you know, just to give you a little bit more force. And then I moved over to the machines when I felt strong enough. So I hope to be doing, you know, I've always enjoyed competitive sports when I was younger, tennis and squash and baseball and American football. I was always pretty sportive. But when I had my crisis with rheumatoid arthritis and my prosthesis, I had to finish with competitive sports. And I really thought, like, I mean, I still miss it. But, you know, when I started to go back to the gym, I almost got the same buzz, you know, just from working out, having a good workout. I do your cardio, do your stuff, push it out there. And after 45 minutes or an hour, you come out feeling on top of the world. So I don't miss competitive sports as much as I thought I would. Because some people say like, oh God, you know, the gym is so fucking boring. Pardon my French again. But I'll tell you, if you put your earphones on and you put on a podcast or music, the time just goes like that. I've listened to more books in the last couple of years with audiobooks than I've read in 2 decades.
Wow.
You know, and you just get because when you're working out, it's like it's a good time to use your AirPods or for a podcast or a book because you're doing something manual and you're just totally focused on what they're saying about the book. And the time flies by. And I'm a big aficionado of audiobooks, but you've got to do it at the right time. Driving a car is a good time as well. Working out is a good time. Ironing is a good time, although I don't do any ironing. But if you do anything intellectual, forget it. You lose the plot. Also, don't do it at night because you just fall asleep. So you need to be doing something moderately active but manual, and the book just sinks into you. I love audiobooks. So I hope to get back to a pretty good form of activity. I want to be able to walk for a couple of kilometers. And before the surgery, I couldn't walk like, after 50 to 100 meters, I'd be in pain and I'd have to stop. You know, going to the shopping center is okay, but I couldn't park the car too far away. And in the shopping center, I take many breaks. So I hope I'll be able to walk across Guincho Beach, which is about 2 kilometers.
Nice.
And, I want to remain active because I enjoy it and it gives you a buzz. And also, I like wearing a waist, which is 30 rather than 35, which I used to be.
Jody, Diogo also says, do you have any suggestions on how to approach MDs for patient referrals?
Well, that's always a difficult one, because it's do you mean like how to get MDs to send you patients or the other way around?
I'm guessing that's what he's after, to get patients referred to him.
Right. Well, that, the medicos there are very skeptical about osteopathy in the UK and in Portugal as well. And I think the issue is that you've got to have a personal relationship with these guys. I've after so many years working here, I've developed a network of I've developed a reputation and a network, and I've cultivated, let's say I've cultivated my contacts in such a way that people trust me. And they know that if I can't treat somebody, I'm gonna refer them to somebody else. But it takes a long time to build up that trust. And I think the orthopedic surgeons and the neurosurgeons, they're probably more likely to send you people than the MDs.
And I think when you messaged me, Jody, you were saying, is there a time when osteopathy needs to hand over to the surgeon? And is there a time when the surgeon needs to hand over to the osteopath?
Absolutely. That's what I was talking to Dr. Monero about, that how we're working, how can, about working together. And he was saying to me, like, he said, we need you osteopaths. And I said to him, yeah, but you have to know who you're referring to, because there's good ones and bad ones. And he said, well, the same thing with me, Jody. There's good orthopedic people and there's bad ones. So I think from the medical point of view, they don't want to send somebody to an osteopath and then they have a bad experience. So I think it's important to somehow make personal contact with them, or to, some people write them letters. Some people start to create in the beginning. They might not even look at your letter, but over time, you'll win most of them over. Not all of them, because there'll always be that guy, that stickler. They say, those guys aren't doing real medicine, they're just, one guy said to me, one of the sticklers at our clinic, who's on the way out at the moment, actually, he said, during COVID, you can't do anything. You can't touch people. I did more during COVID, man, than I did at any other time. Video consultations can be really great. And exercise prescription, all sorts of kind of interesting things like that. So there's always going to be those sticklers, and don't try to convince them. It's just a waste of time to try to convince them. It's like, that article that came out recently, what's wrong with osteopathy?
Oh, yeah.
You've probably seen that a lot. Probably some of the people here have seen that. It was in the Journal of Osteopathic Medicine or something like that. What's wrong with osteopathy? I thought, what a stupid question. It's like, what's wrong with medicine? Of course, it's like, there's nothing wrong with osteopathy. There's nothing wrong with osteopathy. It's the same thing's wrong with osteopathy as wrong with medicine. You just have to, sometimes you get it right and sometimes you get it wrong. And I think for a long time, I felt sort of inferior to our medical colleagues, let's say. I felt like they were like above us in some way. And in my own case, and I think in society, it's probably the case that, if you had to ask most people where doctors are on the hierarchy, doctors are probably up there and the osteopath is down here. But I think in various neighborhoods, there are osteopaths who do really well and have a really good name and can come up there. But as a profession, I think we really need to be more confident about ourselves and about what we do. When I started, I was a bit disappointed that we weren't saving lives. I didn't think we were saving lives, but now I do. I see what the doctors do and what the surgeons do and what we do. And it's the same thing. And people are so concerned about side effects all the time, right? Oh God, a guy might be sore the next day. Every doctor every day has side effects from the medicines he's giving out. And not to mention the surgeons, they're like opening people up. So sure, from time to time, we get unwanted side effects, but it happens. Just do your job the best you can. And as time goes on, people will have less side effects as you get more experience. I still get unwanted side effects, but I'm pretty good at manipulation. And I've got it down to a really, really very quick, very extremely low amplitude. And most of the time people don't feel uncomfortable with it. They just feel like, oh, what did you do there? You know? And it's part of the tool case. I don't use it all the time. Sometimes I use fascial techniques and other techniques and anything that you think will work. But certainly, I think that there's a place for artificial discs. I think you have to do your own research about it. I mean, you know, I didn't know that much about it. It was a surprise to me a week before the surgery that they were going to go in through the abdomen. Oh, that's a great idea. And it was a surprise to me reading all the reviews about it, and they were all glowing reviews. And I was looking for the bad ones.
You didn't find any.
Yeah, it was really hard to find some.
Okay.
So
Has anyone else got any more questions before
I
we
don't know,
move on?
actually don't know why it's not offered more. I think it must be the price.
Jody, Dawn said you're an inspiration and testament to the huge effect of a positive mindset and gratitude for all you have.
Oh, wow. It's absolutely true. And it's like, you know, every challenge that you have, you've got to somehow get turned into a positive. It's like this comes into my mind recently over a number of different things is, you know, you can be bitter or better. And, you know, we're all going to get old. And as we get older, you know, we start to see our friends getting, you know, heart problems and lung problems and this problems and that problems. We're all going to kind of wear out sooner or later. And we can see that as like just like, oh wow, you know, we're all in the same boat, man. We're just gonna die. Or we can say, okay, well, this is our life. What are we gonna do? How can we be positive? And for me, the best way to be positive is to be positive with the people close to me, with my family and my patients and my colleagues. And I don't want to, I can't get into waving signs and demonstrating for osteopathy or for poverty or anything like that. There's so much to do in our own little circle of life. That's where you start. So sure, it was difficult, you know, it was difficult getting over Tiago's passing away. Who was basically, you know, murdered by a drunk driver going too fast through a stop sign. And in June, there'll be a trial about that as well, which I have to go through. I mean, I was like really, you know, questioning if I could find the passion to live again. You know, there were days when it's not just like, how am I going to get through the day, but how am I going to get through the next 5 minutes? And, you know, replaying and everything like that, replaying what happened. But grief is something that kind of grows inside of you. And, you know, it starts like that, and then it turns into this and this and this, and it has layers. And of course, sometimes you get those, you know, you see something, you smell something. I walk into Tiago's room, I smell him. It's like, oh my God, you know, it passes through you. But it's not, in the early days, it was like you're completely in the valley of death, and you don't know if you're going to come out. But I just kind of feel like, you know, I want to make something positive out of this. And I want to make something positive, you know, out of the fact that I've had chronic pain for 3 years. I've become a chronic pain specialist. You know, I'm reading everything about chronic pain, everything around chronic pain. What's your triggers? What makes it worse? Do you feel desperate? Does it stop you from going to social events? You know, having had chronic pain, I've got a whole questionnaire now that I can deliver to the patient. So the patient starts to feel more comfortable. Maybe he can get control of his chronic pain. You know, maybe he can find triggers to get through the day. Because some pain isn't going to go away. It might get better, but let's face it, some people are going to have chronic pain. We can't And we can help them with that. And it's not just helping them with the pain, but their reaction to the pain. That's another thing that we deal with, right? So whoever said, somebody just said, being an inspiration. I'd like to be an inspiration, and in a very true kind of way. I've done the ego thing, man. I've been the best osteopath in Portugal. I don't have to do that anymore. I just want to help people. It's
Yeah.
always been my passion to help people, my mission. I wish I would have become a banker. I would have been rich by now, but not really.
No, we'd have missed you. Well, Norma Jean says, thank you so much for sharing, Jody. Quite inspiring. I would love to continue working well into my 80s too. I had always worried how much my own body could take in spite of doing my utmost best to remain active and healthy. I wish you a speedy recovery. And she's had to dash. There's a few had to dash now. Oh,
Yeah, I have to dash too. But I've thought, like, I think a lot of osteopaths, I don't know if this is true or not, but let me just put it out there. A lot of osteopaths go over to cranial osteopathy because they're getting old. And they don't want to do so much standing and physical work. What do you think, guys? That's a good one.
I don't know, Paul, did you have a question?
Oh, thanks, Sarah.
Tanya says,
Tanya,
really interesting,
great.
speedy recovery from Cheryl.
Yeah, in a month's time, I hope to be at least going to the gym, some of the time, and going for some walks. I haven't been out around the park yet. And
Yeah.
after this, by the way, this is the longest time I've been sitting for a while. I'm probably going to suffer for a bit, but that's okay. It's been worth it.
They're all saying thank you, Jody. All right, well, we'll arrange another one for a month's time.
Yeah, and what I suggest to the guys out there is go and Google it. And as I said, there's some great animations. Go for the short animations. Don't go for the full surgery. The animations are really cool, 3 to 5 minutes. And it gives you basically what they do. Check out the reviews and find out for yourself, and ask around in your area if artificial disc replacement is available.
Yeah. Okay. They're all wishing you well, Jody.
Oh, wow.
I'll
I've been away for a while, Jilly, I've been like so many things happening. It's like a tsunami. I can tell you this though. I've got a lot more pain than I had 50 years ago, but I have a lot more feelings of fullness and just loving to be alive.
That's good to hear.
Yeah. You don't finish at 70, man.
No, I don't intend to.
Nope. 70. So, okay, guys, take care. It was great talking to you. I want to do more of this. And Jilly, thanks for inviting me to do this as well.
Pleasure. It's a good idea. And we'll follow up. I'll get all the information out there. Thanks for coming, everybody.
Take care. Bye.